Hello, and welcome to today's episode of our podcast, where we explore the world of mental health and addiction recovery. This episode is a companion piece to the course 3 CE Hours Peer Support for Addiction, offered by Therapy Trainings. If you're a mental health professional, counselor, or therapist, you're in the right place. Today, we're diving into the key concepts of peer support in addiction recovery, discussing its benefits, ethical considerations, and effective practices that you can apply in your work. Now, before we start, let's take a moment to clarify what peer support really means. Simply put, peer support involves individuals with shared experiences providing emotional, practical, and social support to one another. In the context of addiction recovery, this means that those who have faced similar struggles can offer guidance and understanding to help others on their recovery journey. This unique dynamic fosters a sense of community, reduces feelings of isolation, and can significantly enhance an individual's recovery process. Throughout this episode, we'll cover the definition and benefits of peer support for addiction, the ethical considerations to keep in mind, how to support individuals with co-occurring mental health disorders, and how to navigate difficult situations in peer support settings. We'll also touch on measurement tools and advocate for the integration of peer support into addiction treatment policies. So, grab a cup of coffee, settle in, and let's explore this important topic together. First, let's dig deeper into the benefits of peer support for addiction. Research shows that peer support can lead to improved treatment outcomes, including lower rates of relapse and higher levels of engagement in treatment. Why is that? Well, one reason is that peer support provides a sense of belonging. When individuals struggling with addiction connect with peers who have faced similar challenges, they often feel understood on a level that traditional therapeutic relationships might not always provide. This connection can be incredibly validating and can help individuals to believe that recovery is possible. Let's consider an example. Imagine a young woman named Sarah. Sarah has been battling alcohol addiction for years and feels incredibly alone in her struggle. When she attends a peer support group, she meets others who share their stories of recovery. They laugh, cry, and support each other through the ups and downs. Sarah leaves that meeting feeling inspired and hopeful, realizing she's not alone. The power of shared experience cannot be overstated. It's like finding a lifeline in a stormy sea. Now, let's move on to the ethical considerations that come with peer support in addiction settings. It's essential to establish clear boundaries to protect both the peer supporter and the individual receiving support. Peer supporters should understand their role is not to act as a therapist or counselor, but rather as a guide who shares their lived experience. This distinction is crucial. It helps to maintain a safe and supportive environment while preventing potential conflicts of interest or emotional burnout. Additionally, confidentiality is paramount. Anyone involved in peer support must respect the privacy of those they are supporting. This builds trust and creates a safe space for individuals to share their experiences without fear of judgment or repercussion. Another complex area we need to consider is the intersection of addiction and co-occurring mental health disorders. Many individuals in recovery struggle with both substance use disorders and mental health issues. For instance, someone dealing with depression may turn to alcohol as a means of coping, creating a cycle that can be difficult to break. Peer support can be incredibly beneficial in these situations, as peer supporters with similar experiences can offer empathy and understanding while encouraging individuals to seek appropriate professional help when necessary. Navigating these complex dynamics can be challenging. It's vital for peer supporters to recognize their limits and to know when to refer someone to a mental health professional. This doesn't mean they can't be supportive. Rather, they must understand that while they can share experiences and offer encouragement, they are not substitutes for professional care. Now, let's talk about navigating challenging situations and managing conflicts in peer support sessions. Conflict can arise for various reasons: disagreements, misunderstandings, or differing opinions. It's crucial to approach these situations with empathy and understanding. Active listening plays a key role here. When someone feels heard, it often diffuses tension and allows for a more productive conversation. Consider this scenario. Two members of a peer support group have differing views on a specific coping strategy. Instead of letting this disagreement escalate, a skilled peer supporter could facilitate a dialogue by encouraging each person to express their thoughts and feelings. This not only helps to resolve the conflict, but also models effective communication skills for all group members. Speaking of effective communication, let's explore some measurement tools and evaluation methods to assess the effectiveness of peer support interventions. It's essential to have a way to gauge how well these programs are working. One effective method is to use feedback surveys. These can include questions about participants' experiences, perceived benefits, and areas for improvement. Quantitative data can provide valuable insights into the overall success of peer support initiatives. Another approach is to conduct follow-up interviews or focus groups. These discussions can uncover deeper insights about what works and what doesn't in the peer support process. Collecting this information not only helps improve the program, but also empowers participants by making them feel heard and valued. Continuously enhancing the quality of peer support programs for addiction is critical. Regular training for peer supporters can ensure they are equipped with the latest knowledge and techniques to provide effective support. Therapy Trainings offers robust resources and courses that can aid in this endeavor. By investing in ongoing education, peer supporters can feel more confident in their roles and better serve those they support. Now, let's shift gears and talk about advocating for the integration of peer support in addiction treatment policies and funding initiatives. This is a crucial area that requires attention. Many traditional treatment approaches may overlook the value of peer support, focusing solely on clinical interventions. However, we know that peer support can complement these efforts and lead to more holistic treatment outcomes. As mental health professionals, it's essential to advocate for policies that recognize and fund peer support programs. This can include writing letters to legislators, participating in community forums, and collaborating with organizations that prioritize mental health and addiction recovery. Remember, your voice matters, and advocating for change can create a ripple effect that positively impacts countless lives. Now, let's take a moment to address some common misconceptions related to peer support for addiction. One prevalent myth is that peer supporters are simply friends or buddies to those in recovery. While friendship is a component, peer support is much more structured and intentional. It involves active listening, sharing experiences, and offering guidance based on those experiences. It's a professional relationship, albeit one built on mutual understanding and respect. Another misconception is that peer support is only for individuals with severe addiction issues. In reality, peer support can benefit anyone who is struggling with any form of addiction, whether it's substance use, gambling, or behavioral addict, IONS. This inclusivity is vital because it allows a broader range of individuals to access support and resources. As we wrap up this episode, I want to leave you with some thought-provoking insights. The power of peer support lies in its ability to bridge the gap between professional treatment and personal experience. It reminds us that recovery is not a solitary journey, but one that can be enriched by connection and understanding. If you're inspired to deepen your understanding of peer support for addiction, I encourage you to visit therapytrainings.com for more courses and resources. Whether you're looking to enhance your skills, learn about best practices, or advocate for change, Therapy Trainings has something for you. Thank you for joining me today in exploring the vital role of peer support in addiction recovery. Remember, every small step you take can lead to significant changes in the lives of those you support. Until next time, take care of yourself and continue to be a beacon of hope for others on their recovery journey.